Hey guys, I'm Jared Moss. I'm one of the urologists here at Regional Urology. It's March Madness, and so we're also going to be talking vasectomy madness. It's one of the most common times of the year to get a vasectomy. Men typically need about 24 to 48 hours after a vasectomy to recover, so it's a great time of the year. If you're going to get a vasectomy, you've got plenty of basketball on TV while you're taking some time off. We'll go through a couple of questions, just trying to get you some education on this and see if we can help you understand what a vasectomy is and if this is a procedure that would be good for you. So the first question is, what is a vasectomy? It's a procedure that's typically done in an office setting. It takes about 10 to 15 minutes to perform a vasectomy. It's typically performed through either one or two small incisions in the scrotum. The vas deferens is the tube that carries the sperm is brought up through the incision. It's divided. It's then clamped with either permanent clamps or stitches that are tied off. It's then lowered back into the scrotum, and then the area is typically closed with an absorbable stitch. So a very minor procedure. What does a vasectomy entail? Basically, it involves the process that we just talked about. You'll typically get some medicines beforehand or during the procedure to help get you nice and relaxed. We just tell people, look, if you're nice and relaxed, it makes it easier on us. If it's easier on us, ultimately it's going to be safer for you. Again, 10 to 15 minutes, you'll be able to go home the same day. We ask that you ice over the next 24 to 48 hours. If you have a vasectomy on a Friday, typically most men are able to go back to work on a Monday as long as they're not having strenuous activity at work. Also really important to make sure that you don't have any unprotected sex until you have two negative semen specimens. The short area of the vas deferens is divided, but you still got to clear everything downstream. So it's very important that before you've cleared, that if your partner, your wife, that you're still using contraceptives, if she's on birth control or things like that, that needs to be continued until you've cleared. And that's easily done through bringing in a semen specimen and just verifying that there's no sperm in the ejaculate. A lot of times guys will ask, is everything going to work the same after a vasectomy? The short answer is yeah. There's nobody that's going to sign up for a procedure that's going to change anything in that area. About 500,000 men every year choose to get a vasectomy. So erections, ejaculation, sex drive, testosterone, all those things work exactly the same. So I tell my guys, once you've healed up, you shouldn't even be aware that you've even had a vasectomy. The next question is, what are the risks of having a vasectomy? And the short answer is it's a safe procedure and it's very low risk. Risk of a blood collection in the scrotum is very rare. Risk of an infection, extremely rare, 1 to 2%. Risk of the two ends actually growing back together is typically about 1 in 2,000. So it's extremely rare, but it can happen. Risk of having long-lasting pain in the testicles is also unbelievably rare. So it's a safe procedure. Again, that's why so many guys choose to do it every year. Another question may be, well, how do I schedule an appointment to learn more about this and see if this is something that I'm interested in? Our telephone number is 318-683-0411. We also have other information on our website, regionalurology.com. You're welcome to visit that. You'll find some good information there. So I hope this has been helpful. If you have any questions, please leave it in the comments. We'll try to get back to you with a response as soon as possible, and we'll go from there. Thanks for tuning in.